Uh, Hello, everybody. Welcome to another episode of What's Next After BDS. Today, I have with me Dr. NEERAJA, general dentist from the UK. She was my batchmate in UG from Sri Ramchandra University. Hi, NEERAJA. Can you give us a short intro about yourself?
Hi, Vinay. So, I first like to congratulate you to start, make this initiative to help students who are graduating now. And with regards to me, after my dentistry in Ramchandra, I came to the UK, did my overseas registration exam, registered myself as a dentist, and now working as an assistant dentist in Scotland.
Amazing. So overseas registration exam, and we are going to refer it as ORE throughout this interview. Okay.
Yes.
So ORE is the exam, license exam to practice in the UK, correct?
Yes. Yeah,
correct.
it's a license exam.
So my first question is, I know you were from the UK, you spent some amount of your childhood in the UK. Any other particular reason as to why you chose UK to pursue your career as a dentist?
For me, it was basically family, main reason.
Okay.
The other one is it's a bit easier. Once you finish your ORE exams, you're straight into, you can get a registration and start working as soon as possible.
Okay.
As long as you're able to, pass the exams and all that.
That's good. That's good. Now, for any foreign exam, when you're coming, somebody is coming from India, right? So they have to go through this process of GRE, TOEFL, and they check what my other friends told me, something known as your average of your final year marks or something like that, right? So what are the requirements to be eligible to write the ORE?
So for the ORE, the main thing is English proficiency, because we don't come from an English speaking country. Correct. So you need to do IELTS exam.
IELTS,
and okay. IELTS. So you need to get 6.5 in each of the modules minimum, and overall band of 7.
Okay.
So that is the main criteria.
Okay.
The next they will ask you, in the application, they'll ask you clinical experience. So 1,600 hours of experience you need in order to apply.
1,600 hours of clinical experience. You mean this refers to our internship?
Internship.
So our internship is counted as clinical experience, or you need to work in a clinic apart from that? That's what I'm asking.
They will accept your internship experience.
Okay.
In addition to any postgraduate experience and any private practice experience.
Okay.
All that.
So that, like you were saying, you require 1,600 hours of clinical experience and IELTS exam, right? Anything else?
And you need to have something called a Enix Certificate, ENIC.
Okay.
It's a statement of comparability. So basically they'll say that, okay, our Indian degree is comparable to the UK undergraduate degree.
Okay.
So you need to get that certificate as well.
So ENIX is just a compatibility, saying the Indian degree is equivalent to the UK degree. So,
yes.
So BDS must be common all over India, right? So everybody gets it easily, right? Not quite an issue to get the Enix.
It's not it's all accepted usually.
Correct. Any ENIC.
ENIC.
Okay. Any letters of recommendation do you require?
Letters of recommendation you would not need, but they will ask for references. They will ask character reference and clinical reference. Okay. So they ask only details like email and contact details, and the GDC will contact directly to your references.
Okay. So once you have, sorry to interrupt. Yeah, sorry.
So you have to make sure the references know that you've given their details, and so the process is quicker.
Okay. And does your marks obtained in your 4 years, does it make a difference while applying for the ORE exam?
Not. Because as long as you get your certificate, it's usually after your convocation that you can even apply, because they need your degree certificate, and they will not accept any of the provisional certificates.
Okay, just the degree which matters.
Yeah.
So can you briefly tell us how many parts does ORE have?
So ORE exam has 2 parts.
Okay.
So part 1 is theoretical, and the part 2 is completely practical. So before I go into that, I need to tell you, you also need a certificate of good standing from the Dental Council.
Okay.
Which is also a document to be attached to your form.
So good standing in the sense, do they talk about the conduct?
Yeah, the conduct, so that you don't have any convictions or anything in your country.
Okay.
It's just a certificate to say you've worked and it's been
Okay.
fine.
Okay. Okay. So Dental Council of India is going to contact your college regarding this and just give it to
You go as your own, you represent yourself, you ask them for a letter of good standing, they will know what to give you.
Okay. Nothing to do with your college.
Not your college. So
Okay.
it is your dental council of the state or, okay.
That's great. That's great. Okay. So moving on to Ari. So there are two parts, like you said. So what is the first part about?
The first part is completely theory. First part is got part A and part B.
Okay.
Part A is going to be applied anatomical sciences or basic sciences.
Okay.
And part B is completely clinical dentistry and laws and ethics in the UK.
Okay. So are they going to cover your clinical subjects in part A or only the basic sciences?
Clinical subjects as well. So part A, second part of the part A will be clinical subjects.
Okay.
All your clinical dentistry. Part A would be your anatomy basic sciences, which is applied to your clinical.
What about the format of the examination? Is it MCQs or essay types or SAQs?
It's mostly MCQs and extended matching questions.
Okay.
So extended matching is that they'll give a question with 10 answers.
Okay.
And then they will give the same 10 answers for the next sequence of 5 questions. So you choose which is the right answer.
Okay. Something like the best answers you have to get to choose. Right?
Yes.
Okay.
Yeah.
So how much time do you think will an average student require to prepare for part A? Because as far as I remember, you were an excellent student in the UG. You were used to come on the top of the class. So for say someone like an average student, so how much time do you think he should devote before he takes part 1? I know it varies from person to person, but at least just an average.
Yeah, it will take around maybe 1 or 2 months if you really focus on it and you prepare. You can crack it in a couple of months, especially if you're a fresher out of college.
Okay.
Because all your knowledge is all fresh.
Okay.
Correct. But if you've not much experience, maybe it'll take longer. If you've had a big gap, then it might take longer. But if you're a fresher, it should be quick.
And what about the study materials? Is there a prescribed study materials you have, or you just based on whatever the website says, you have to prepare accordingly?
So there are 2 books, basically they recommend.
Okay.
One is Oxford Handbook of Applied Dental Sciences.
Is it the pink color book?
Yeah, pink book. Pink book is the clinical dentistry, Oxford Handbook of Clinical Dentistry. And the blue book, they call it is Oxford
correct. Yeah.
Anatomical Sciences.
Okay.
So those 2 books are the base, but they will not be detailed. So what I did was I used our own undergraduate textbooks, Chaurashia and everything else.
Okay. That's nice. That's nice.
In addition to these, to understand, to answer those questions.
That's great.
And there are books called Past Test, a series of books. So they have got
some by Kathleen Fan, right?
Yeah.
Kathleen Fan. Okay, nice.
So those books as well will help you.
Okay. So that's about part 1. So what is the gap you need to, like, as soon as you clear part 1, can you give the part 2 immediately, or how much time do you recommend? I'm basically for preparation. That's what I'm asking.
You can, if you're confident, but it usually takes a few months, at least 2-3 months to prepare completely for part 2, because part 2 exam is the main one and the pass rate is not much either for that.
Okay.
In that you've got like 3-4 exam modules kind of thing. Okay, 3-4 exams. So you've got something called an OSCE, where there'll be like 20 different stations where you go to each station and they'll give a question outside. So you have to prepare. So some would be based on diagnosing a patient, or something explaining treatment planning to a patient. Some stations would be like skilled OSCEs, where you have to show X-ray positioning on a mannequin head, or suturing, things like that, or written OSCEs as well. So there are a lot of different stations in that's one of the parts of part 2. And the other part is your mannequin, which is the main one for us. So it's like 3 major exercises and two major and 1 minor exercises they tell you to do. For example, all the class 1 to class 6 preparations and filling amalgam, mostly amalgam fillings, and some composite fillings.
Okay.
And crown preps, root canal, obturation, or access opening. So things like that, they'll ask you to do and you just have to do it on the day. And there's another part which is like complete history taking till treatment planning, and then explaining to the patient.
Okay. So you'll have a model patient, right? Dummy patient where...
all of them are actors. There is no real patients in the exam.
Okay. Okay. So in the second part, there is absolutely not going to be any form of question and answer. It's just clinical scenarios, OSCEs, and it's going to be the practical skills which are going to be put to test.
Yes. So you would need some time for it. And there are courses in the UK that conduct,
okay,
to prepare for these exams.
Prepare for this thing. That's good. That's good. Now, my question is, suppose you don't clear part 2, do you have to take the part 1 again, or you have another attempt to go for it?
So actually part 1, you've got 4 attempts maximum.
Okay.
Okay. And part 2, similarly, you've got 4 attempts maximum.
Okay.
So if you fail in part 2, you don't have to repeat part 1.
Okay.
But you need to finish it within 5 years of starting the exam process. So if suppose you started part 1 now, in 5 years time, you should have completed part 1 and part 2.
Okay. So if you take the exam, say you've cleared part 1 by this month, and I have 4 attempts for part 2 in a period of 5 years.
5 years, yes.
Okay. Okay. So once you clear part 2, you are licensed to practice in the UK, right?
Yes. Yeah.
So can you just tell me which all countries come under the UK license system?
So UK consists of Wales, England, Scotland, and Northern Ireland.
Okay. Okay. I think you're currently working in Scotland, right?
Scotland, yeah.
Okay. So that's great. Thank you so much. And how is your work experience going on there?
It's going fine, actually. It's not very different from India, what we do. It's just a lot of note taking and, those kind of things which you're not used to in India. So that's something different here. Okay. But you'll get used to it. It's quite nice here. And
do you have any idea about, can you just brief us a short, journey from here towards post-graduation? If at all you want to pursue, pursue.
Yeah. So in order to work under the NHS, the National Health System in the UK, you need to do 1 year of training when you come from abroad. Okay. So once you get your registration, you get registered with the GDC, you do 1 year of training as a vocational trainee somewhere, and then you get your performer number. Okay. For England. So once you get that, you are an independent self-made dentist. So you're an independent person, your work. At that point, you can do postgraduate courses. That is one option. Some people come here to do a post-graduation and then sit their ORE exams during the post-graduation course. Okay. So by the time they get their PG and get the registration, they'll be good to work.
But while applying for the post-graduation program, don't you need an ORE?
You don't need it when you apply, but when you come to the post-graduations are usually 3-year courses or 2-year courses. Okay. So the first year will be theoretical. So at that point, you don't need to have a registration. Okay. But when you start looking at patients, you need to be registered in the UK. Okay. So it would be very, you'll have to finish the ORE within that 1 year. It is difficult. Some people do it. Okay. And they're successful with it as well.
So what are all the post-graduation specialities? I mean, I believe you can't do maxillofacial surgery because you need an MBBS for it.
MBBS.
You can do oral surgery, right? There's something
oral surgery, yes.
Not maxillofacial. And the rest of the 8 departments is the same as it is.
Same as, yeah.
Oral pathology, including the non-clinical ones. Oral pathology, oral medicine, prosto, endo, pedo, and all.
Yeah.
Okay, that's nice. So are you planning to do your master's?
Not at the moment, but yes. Sometime in the future.
You have the ideas in mind. Okay. Okay. So thank you so much, Neeraja. That was so nice talking to you. And okay, just one final question. Yeah. Suddenly popped up. Is there any way to get an exemption for ORE Part 1?
Not that I'm aware of. Okay. There is something called temporary registration, but some people, they can come here work, but then not an exemption from Part 1. Okay. You'll have to do your OREs. Okay. But there is another exam called LDS. Okay. Which is done by Royal College of Surgeons. Okay. It is basically like a degree or diploma, something you write behind your name. Okay. Okay. That will also allow you to register with the GDC. Okay. But unfortunately, I don't know much about it because I've not done it.
That's good. That's good. Thank you. Probably I'll try to find somebody who has done the LDS. And okay, one more question. How much does the exam fees cost? Part 1 and part 2?
Part 1 is around £800
Okay.
per sitting.
Okay.
And part 2 is around 2,000 to 3,000 pounds. I think it's 2,929 to be exact.
2,929 to be exact.
2,929 to be exact. But there are no exams that are available for this year. They've not received the exams yet, but it's good to have a lookout for them.
Okay. That's nice, Neeraja. Thank you. So happy to see you doing well in the UK, and probably we'll have another interview soon with your master's degree.
Yeah, sure. Thanks for having me.
Anytime. Goodbye, Neeraja. And just one request. Is it okay if I can share your email ID in this video so that if people have any queries, they can mail you, right? That's okay with you, right?
Yeah, sure. I'll send you that.
Thanks, Neeraja. Take care. Bye-bye.
Bye.